Thank you so much, Linda.
Don't hurt your shoulder. Save your shoulder.
Our next speaker is Julia Weinberg. Julia has been practicing licensed registered nurse for 26 years. She's currently works in the post-anesthesia care unit at Skagit Valley Hospital. She's previously worked in the medical and surgical care and critical care units. In 2009, Julia was elected to a 2-year term as president of the Washington State Nurses Association.
Yeah.
Give you Julia.
Wow, look at all the people here. What do we want today? Healthcare reform. When do we want it? Now. I'd like to thank you for having me here today. You know, as a registered nurse, we take care of you every single day. And as a Washington State Nurses Association president, I represent 11,000 registered nurses here in Washington State. As Washington State Nurses Association, we're a constituent member of the American Nurses Association, who represents the 2.9 million nurses in this nation. And we're all speaking out that we want health care reform now. We're tired of waiting. I have been practicing and I've been working on trying to get health care for all since I became a nurse. I see every single day the effects of when people don't have insurance and they need to have emergency surgery, and it's a shame and it makes me so sad when I have them wake up and say to me, rather than, am I okay, how am I going to pay for this? And how am I going to be able to recover? Will I recover? And I say to them, don't worry about paying. We need to get you well so that you can get out there and take care of you and your family. I see this every day, and it is a shame that here in America we can't do the right thing by our people. The American Nurses Association has always said that we believe that health care is a right. It is not a privilege. It should be a right and it should be supported, and that's what we need now. We also need to make sure that each and every one of us have access to care, access to a primary care physician, nurse practitioner, or other health care provider. If you can't get into the system, we can't help you. And so that's important to us when it comes to health care reform. Nurses are supporting access and having the appropriate person be that person. We also believe that the public option is an option that needs to happen. And I'll tell you why. The insurance companies that are of today, they're a monopoly. They basically oust you and the costs go up. If we don't have a public option for the rest of all of us who can't afford those kind of insurance rates, we're not going to have real health care reform. So whatever bill comes out of the Senate, it must have a public option. That is not an option not to have the public option. So we can't get discouraged. The things that are going on right now, we have to stay motivated, each and every one of us. Turn that disappointment into anger and that anger into proactivity. Keep calling, keep writing, keep showing up. And if necessary, maybe we need to walk into Pennsylvania Avenue, 350 million of us. We want it now. So thanks everybody. Let's keep fighting.